Thank you very much. I'm going to be very brief. My name is Grigori Mikarekunyu Ebaliman, 73 years. And the nurses and medical workers, thank you very much. My message to is, successful people have a lot of enemies and failures have a lot of supporters. Continue doing what you are doing. To the people of Soroti, the truth about the matter is that there are some of them who are doing a good job, but there are some of them who are not doing a good job. Let us not use deductive word reasoning. Let a good own his word is false. I think that's my message. State House, I want to request that you have taken the three things which I've got here: corruption, then the use of language, then lack of what? Respect. That's what I want. My request is, now that you are here, I want to pray and hope that you will come back at a certain time to tell us what you got, what you think you have done, and what you think is on the what? On the ground. Then I also want to request, I think let us also help the other structures. For example, the office of the RCC, the office of the what, so that even when you are not yet here, they can keep on evaluating what's happening in these places here. So that they can even give you a report to say, please come, what we have on the ground is ABCD. But so far, it is not very bad. But my request, which is the last one, let us also facilitate the other lower health centers. Because now everybody is coming to the referral hospital. But if maybe those places also working, maybe the number coming here would have confused you.
Thank you.
You please the president, we are Ayam.
Sanga is my name, and I'm an opinion leader like a quick one. It has ended with the burden of the regional hospital. It looks like Soroti Hospital is a city hospital and district hospital. I thought we have 11 Teso districts. Why is the burden so big, like he's saying, and yet we have all those lower centers? When you talk about referral, I need to be educated. What does it mean? Why would we accept first-time contact patients in a regional hospital? I'm just asking, unless you teach me some English. If you are referred from anywhere, whether lower level, whether from Katakwi, from any other of the other districts, that's what a referral means. Commissioner will have to tell us about that. If it's a referral hospital, you must come to a regional hospital with a referral note. Point number one. And it's regional. Dr. Poro has been spoken about on many things. Dr. Poro is my I don't know who. Because he has helped me, I wouldn't be alive. The gentleman was supposed to have gone to Arusha. He postponed his flight on a Saturday and he said he'll go back on Monday. They are committed people like these ones. Why don't we recognize them and appreciate them? If you also get him a car or something for some of those consultants, wouldn't it motivate others? Let us think about it. Those consultants, just like other senior government officials, should be driving some state-of-the-art cars so that they are also seeing the community as doing good work for the people. And the Poro should be the first man to get. I'm pleading for you. Even Sister Jiku, sisters and all others, people have committed themselves. Political leadership, Mayor, you are here. I know you are in opposition, but I'm also NRA. Can we have one day in this city where we can go and clean our city? Like Uganda does. All these trenches are full of conveyors, everywhere defecations and every other things. What is the leadership doing in this town and all the other divisions? Why don't we bring out a sense of responsibility and stop littering in town? Because medication is another thing, but hygiene is very important in the community so that people live a healthy life and a healthy community. If you come in my house, where I operate from, you will not see a cavera. I'm going to visit you, Mayor, if the cavera is there. Last but not least, who is laying this Soroti University Teaching Hospital? Who is laying this Soroti University Teaching Hospital? We got Soroti University, and there is no university within its pandemic peripheries Why do you have a teaching hospital? Why don't we take advantage of the leadership of the Vice President, the leadership of Honorable Anita, the leadership of the Budget Committee Chairperson, Ishiaki, and all the others, and help us to get this hospital, get a teaching hospital. We are becoming small kids in constituencies. We want to have our constituencies taken care of. I'm sure I'll speak this one with heavy heart. Come back to the region and help our university get a regional hospital, so that the teaching hospital benefits all the people of Teso instead of small constituencies. So that we have research, centers of excellence and quality service given from a university hospital. Our children will do better when they have got proper teaching within the areas of the excellence.
Thank you. Most of this baraza was brought to this country by the Founding of Honor, who had the privilege to be a student in Dar es Salaam University. And this concept was in Tanzania during the late Marine Junior Nyerere Pan-Africanist, where he demanded that the citizens should interface with the duty bearers and the duty bearers account for the service, for the trust that the people have given them. So this concept gives us an opportunity to listen to the people who receive the services, to take advice, to take notes, and indeed to improve service delivery in this country. I want to congratulate all of you who have come in big numbers, even when no transport cost was involved, but you paid the bills and you have stayed all this long because you were in this very important process. A big hand clap for the participants. I want to quickly recommend, therefore, that the management of the hospital you have seen that this is very good for you, for us, when we make many discoveries. And I've heard from the Minister of Health and the Director of Monitoring that we received some little money for quarterly barazars. How I wish we don't wait for the health monitoring unit. We organize quarterly barazars, a small composition in the referral hospital, and we point out to you the obvious and unknown. Because we have seen that the people in charge of our health facility are quite positive and they really want to improve. When I saw the in charge of the referral hospital wanted to respond, I saw that he was talking from the heart. We have also recommended that every quarter we look forward to seeing a baraza not only in the referral hospital but in all other health facilities. I have seen some DHOs from other districts, so the message should go across. And we want to task the Office of the Residency Commissioner, which is mandated to superintend on these barazas so that this comes to pass. We want to observe that it was noted that the health professions, the majority of them, are doing a good job. Names were mentioned. You, the other health professions who did not hear your name mentioned, how do you feel if you were mentioned as a celebrity? Everybody talking about Dr. who got a medal. Everybody. The other day I was watching on TV, what we could produce the monitoring. I saw Dr. Kodo with a very big medal. Government has given him a medal. But of course there was a very good recommendation here that why don't you also give with vehicles? We have captured it and government will think about it. But in this world of decentralization, you don't wait for central government. The district leadership as council, you can say that during every end of the year party, we need to recognize doctors who have performed exceptionally. And we can give a bull the upcoming mayor. How is that? a very good recommendation. And when I'm supported by the mayor, we shall have it. Why not? So before we talk about government that is very far, we have government and governors here who make very important decisions. The work of the residency commissioner and the RDC is to advise the district chairperson. We shall do exactly that, and we are recommending that we need to have functions where you account, where we can improve. I therefore also want to direct that residency commissioner, we have had complaints of extortion, and this is spoiling our name, actually, for the good people. It is something to take little interest. Because when a senior citizen comes before the camera and says, I even have a receipt, and we wake up here and go home when we have not interrogated that one, it wouldn't be a good picture. I therefore want to request the RCC and your big team, and I think I want the big team to be prominent here. Members of the Residential Commission and your team, come here. We have a very good team, and this is the team you should immediately report it to. You the one those small challenges in the right offices. We are also aware that some regional hospitals are far above 22%. We also observe through the monitoring unit that while we have the professors, we have the consultants, the lower staff here are lacking. We have listened with pain that the health centers in the entire Soroti district and the city don't work over the weekend. And the DA was giving an explanation that because we have one clinical officer who works from Monday to Friday, and automatically he gives himself a holiday over the weekend. We shall have engagement and we interrogate this and see how best. But the answer is largely in the ministry, in the partnership with the Directorate of Health Monitoring. We hope there will be some intervention.